Sore, Dokter.
Bisa didengarkan suara saya, Dek?
Bisa, dokter.
Bisa. Oke. Ini sudah ada Dokter Asri juga. Dokter Dia juga sudah hadir nih.
Iya, Dokter Dia sudah hadir juga. Selamat siang, selamat sore ya, sore Pak Fiano, Dokter Dia. Halo, selamat sore Adik-adik.
Sore, dokter.
Sore, Dokter.
Selamat sore, dokter.
Selamat sore Pak Fiano dan Dokter Asri. Selamat sore adik-adik. Nanti akan kita laksanakan video session ya. Nanti bisa dibantu oleh Dokter Asri atau Bapak Fiano untuk share videonya. Mohon maaf saya off kamera dulu. Terima kasih.
Terima kasih Dokter Dia. Apa mungkin kita bisa mulai ya Pak Fiano dan Dokter Dia dan adik-adik sekalian?
Iya, dokter bisa dimulai.
Bisa, Dokter.
Saya coba share screen ya. Jadi teknis untuk video sessionnya ini, jadi karena adik-adik di FKG, nanti kita akan melihat beberapa video terkait dengan pembentukan gigi ya. Dan kita lihat juga struktur-struktur yang ada di gigi. Sebelumnya saya sudah berikan kuliah ya, mungkin belum kebayang sama adik-adik gimana yang mananya ini, mananya itu, terus selnya ini apa, gimana gitu ya. Jadi kita lihat aja untuk lebih jelasnya pada video session ini. Jadi nanti ada video, kita lihat dulu videonya, kemudian setelah videonya itu selesai, mungkin ada yang mau didiskusikan atau mau ditanyakan terkait dengan video tersebut ya. Bisa kita ambil kesimpulannya juga gitu ya. Oke, Pak Dede sudah siap ya? Oke, saya coba share screen. Apa sudah terlihat ya?
Sudah dokter.
Oke, sudah ya. Sebentar. Saya share sound. Oke, kita mulai dengan video pertama. Silakan, Dek.
In the developing human embryo in week 6 of gestation, the teeth will develop in a complex process that involves a myriad of different cell types and tissues. Within the developing jaws of the embryo, epithelial and ectomesenchymal cells will interact with each other to produce teeth. This animation will outline the first 3 stages of tooth development: bud, cap, and bell. Prior to the bud stage, 2 bands of thickened epithelium form in the presumptive upper and lower jaws of the embryo. On each band, a ribbon-thin shelf emerges into the underlying ectomesenchyme. This inward growth is called the dental lamina and signals the beginning of tooth development. The bud stage commences with the formation of small bulges on the dental lamina. These bulges grow into the adjacent ectomesenchymal tissue, creating a bud. As the bud grows, it forms a shape similar to a light bulb attached to the end of a rope as the ectomesenchymal cells continue to proliferate around it. As the development process continues, an infolding appears. The ectomesenchymal cells continue to proliferate within that fold. This formation signals the beginning of the cap stage. Several structures can be identified during the cap stage. The enamel organ is the part of the developing tooth made up of epithelial cells originating from the dental lamina. The dental papilla makes up the ectomesenchymal cells filling the concavity of the cap. Lastly, the dental follicle makes up the ectomesenchymal cells enclosing the rest of the enamel organ. Note that the enamel organ and dental papilla are separated by the basement membrane of the epithelial cells. As the cells of the enamel organ differentiate, several cell populations can be identified. These include the inner enamel epithelium, the outer enamel epithelium, the stellate reticulum, and the enamel knot. The tooth has now entered the bell stage of development. Development of these structures is paired with the formation of cervical loops. points where cells continue to divide until the crown of the tooth is at its full size. The late Bell stage involves the production of the tooth's hard tissues. Meanwhile, the dental lamina begins to shrink and eventually breaks away from the tooth bud. The bud is now separated from the epithelium of the oral cavity as the Bell stage comes to an end.
Oke. Apa ini ya? Live transcript. Oke adik ya, jadi sudah ada di situ. Sampai tahap ini ada yang mau ditanyakan atau mau didiskusikan? Jadi itu mulai dari yang bud stage-nya ya. Terbayang nggak? Mana? Ada yang mau didiskusikan? Kalau belum kita lanjut dulu yang lain.
In the developing human embryo,
Odontogenesis, or teeth development, is a process that includes the development of deciduous teeth, also called milk teeth or baby teeth, and permanent teeth. Deciduous teeth begin to develop during week 6 to 7 of intrauterine life, whereas development of permanent teeth begins during week 14 of intrauterine life and continues to even up to 5 years after birth. Now, teeth are one of the most diverse organs in humans, both morphologically and functionally. The development of teeth begins around week 6 and from two tissue components, the primitive oral epithelium, derived from ectoderm, and the underlying ectomesenchyme or dental mesenchyme. The dental mesenchyme derives from craniofacial neural crest cells that migrate from the developing midbrain and the first two rhombomeres into the first branchial arch. Now the oral epithelium and the dental mesenchyme instructs each other in a sequential and reciprocal way to precisely determine the formation and location of highly specialized teeth, such as incisors, canines, premolars, and molars. The tooth development starts with the thickening of the primitive oral epithelium known as the primary epithelial bands, one on each jaw. Each primary epithelial band soon splits into two, an inner or lingual dental lamina and an outer or buccal vestibular lamina. The vestibular lamina subsequently hollows and forms the vestibule of the mouth, which is the space between the alveolar portion of the jaws, lips, and cheeks. Now signal proteins such as FGFs, BMPs, and ectodisplaysin cause the cells within the dental lamina to start proliferating and to invaginate in the positions that correspond to the locations of the future teeth. These localized, enlarged projections within the dental lamina are known as the dental placodes. Next, as the dental placodes continue to proliferate, the tooth undergoes morphogenesis, which results in different teeth shapes. This is guided by interactions between epithelial and mesenchymal tissues and progresses through distinct stages defined by morphological features of the dental epithelium, the bud, cap, and Bell stages. During the bud stage, the dental placodes proliferate to form a bud-like structure known as the tooth bud that is attached to the oral epithelium by the dental lamina. At this stage, the ectomesenchyme mesenchymal cells start to cluster around the tooth bud, resulting in a condensation of the ectomesenchyme, especially right beneath the bud. And at this point, the tooth bud is made up of two types of cells, an outer layer of low columnar cells and an inner bundle of polygonal cells. Now the tooth bud is unique in that it has a differential proliferation of cells, which means that different parts of the bud grow at different rates. The cells at the center of the bud proliferate slower than those in the peripheries, leading to the formation of an invagination and turning the bud-shaped enamel organ into a cap shape. This is the start of the cap stage. During this stage, 3 different types of epithelial cells can be seen, forming the enamel organ, the epithelial part of the tooth germ, the inner enamel epithelium, outer enamel epithelium, and the stellate reticulum. The inner enamel epithelium is a layer of low columnar cells that line the inner surface of the cap's central depression. The outer enamel epithelium is a layer of cuboidal cells that line sides of the cap on the outside. Finally, the stellate reticulum is a bunch of cells that are linked to each other by desmosomes. The stellate cells secrete glycosaminoglycans into the extracellular space. The glycosaminoglycans attract water into the extracellular space, which pushes on the cell membranes of the stellate cells, turning them into the shape of a star. There are also a bunch of non-dividing cells within the enamel organ that sit near the inner enamel epithelium, known as the enamel knots. The enamel knot is a signaling center that regulates the formation of the cusps of the tooth. The number of enamel knots and their location within the enamel organ determine the number and location of cusps in the developing tooth. Now the ectomesenchymal cells surrounding the enamel organ continue to accumulate, especially near the invagination of the cap. The dense condensation of ectomesenchymal cells beneath the cap is called the dental papilla, whereas the accumulation of ectomesenchymal cells that encircle the dental papilla and the enamel organ is known as the dental sac or dental follicle. As the enamel organ continues to grow, the invagination in the cap deepens, forming the cervical loop at the tip of the invaginating epithelium where the inner and outer enamel epithelium meet. Within the enamel organ, a few epithelial cells between the stellate reticulum and the inner enamel epithelium differentiate into a layer of spindle-shaped cells known as stratum intermedium, and the stellate reticulum start to collapse, reducing the distance between the inner enamel epithelium and the outer enamel epithelium. The tooth germ epithelium then forms the bell-shaped structure that will become the crown of the tooth. The late bell stage is when morphodifferentiation occurs, where the future shape of the crown, such as incisive, canine, premolar, and molar, is determined. It also marks an important stage of histodifferentiation. Histodifferentiation is the conversion of cells of the dental organ into specialized cells, such as amyloblasts, which produce enamel, and odontoblasts, which produce dentin. Following cusp formation, the inner enamel epithelial cells and the dental papilla cells continue differentiating into amyloblasts and odontoblasts, respectively, down the slope of the cusp and up to the cervical loop. Next, as amyloblasts and odontoblasts continue to secrete the mineralized matrix, the dental lamina will disintegrate, which completely detaches the tooth germ from the oral epithelium. Sometimes, when the dental lamina degenerates, it may leave behind nests of epithelial cells called epithelial pearls. These epithelial pearls can give rise to a bunch of abnormalities in the future. For example, supernumerary teeth, odontoma, and eruption cysts. Root formation starts after crown development. Development is underway. The cervical loop cells begin to proliferate downwards to form a two-layered structure known as Hertwig's epithelial root sheath, or HERS. HERS proliferates and migrates downward, guiding root formation, and it also induces the differentiation of odontoblasts forming root dentin. HERS has a limited growth potential, which determines the length of the root. The disintegration of HERS results in the formation of an epithelial network called epithelial rests of molasses, or ERM. This allows the cells of dental follicle to come in contact with root dentin and their differentiation into cementoblasts that deposit cementum on the root surface. The periodontal ligament that connects the tooth to the alveolar bone is formed by fibroblasts differentiating from the dental follicle cells. In addition, the dental follicle gives rise to osteoblasts that form the alveolar bone where the fibers of the periodontal ligament are embedded. These fibers that insert into the cementum and the alveolar bone, providing tooth anchorage, are known as Sharpie's fibers. Permanent teeth develop in a manner similar to that of deciduous teeth, but begins at around week 14 of intrauterine life. The first step in development is the extension of a tiny bit of dental lamina just behind the deciduous tooth bud, called the successional lamina. The successional lamina gives rise to the tooth bud of all the permanent teeth except the molars. The dental lamina in the posterior regions of the jaw bury into the oral epithelium and give off tooth buds that undergo the same stages of development as the deciduous tooth bud. Alright, as a quick recap, teeth begin to develop around week 6 of intrauterine life and can be divided into 3 main morphological stages. After the initiation, the dental lamina forms outpouchings known as dental placodes, which proliferate into enamel organs which change in shape as they grow, starting as the bud, then cap, and finally the bell stage. At the late bell stage, there's histodifferentiation of inner epithelial cells becoming amyloblasts, which lay down enamel, and dental papilla cells, which become the dental pulp, and the odontoblasts, which produce dentin. The root of the tooth forms as an extension of cervical loop cells to form the Hertwig's epithelial root sheath. By week 14, all permanent teeth except the molars begin to develop from the successive lamina, whereas the permanent molars begin developing directly from the dental lamina by week 20 and continue till 5 years after birth.
Oke, ini yang lebih lengkap lagi ya, Dek ya. Jadi yang tahapan-tahapan itu lebih tampak lagi. Apakah sudah terbayang? Bagaimana? Ada yang mau didiskusikan? Mungkin kita lihat dari hasilnya ini kesimpulannya apa ya? Bisa dari yang Adik tangkap ya. Mungkin Putu Feby 049. Halo Feby.
Izin menjawab, dokter.
Ya, silakan Dek kesimpulannya.
Jadi menurut saya, gigi itu terbentuk menjadi 3 tahap, yaitu bud stage, cup stage, sama bell stage, dan late bell stage. Lalu, itu dimulai dari minggu ke-6 sampai ke minggu 20, dokter.
Oke, terima kasih Feby. Mungkin ada tambahan lagi? Rizka, Komang Rizka Cahya, silakan. Komang Rizka Cahya, apakah hadir? Oh, tidak hadir ya, Kak Rizka ya? Halo?
Hadir, dokter.
Hadir, silakan Kak Rizka. Gimana, Dek? Apa yang kira-kira Adik dapatkan dari hasil tadi? Kira-kira yang pendapat Adik-adik apa? Apa ada yang menarik atau bagaimana tentang perkembangan dari gigi itu?
Izin menjawab, dokter.
Ya, silakan. Siapa ini?
Ingrid, dokter. NPM 054.
Ya, silakan Ingrid.
Saya ingin menambahkan sedikit mengenai tahap-tahap yang tadi sudah dijelaskan teman saya. Yang pertama itu bud stage itu merupakan tahapan di mana pembentukan lamina dura, yaitu lamina adalah jaringan epitel di mana penebalan gigi terjadi di situ, dokter. Dan kemudian pada cup stage itu adalah tahap proliferasi sel-sel menjadi organ enamel. Terus pada Bell stage itu di mana sel-sel mengalami histodiferensiasi dan morfodiferensiasi, dokter.
Oke, baik. Terima kasih ya. Jadi ada nggak yang, terima kasih Ingrid ya sudah disimpulkan juga tadi. Menurut saya, jadi selain itu ada satu fase lagi yang tadi. Jadi kan dia baru tahap itu, terus apa lagi yang kurang kira-kira? Ada yang bisa nggak kira-kira? Dentino, namanya dentin ya, ada dentino. Wah, cocok sekali nih di kedokteran gigi ini. Gimana pendapat dentino? Apa yang ada satu lagi yang rasanya kayak kurang lagi satu?
Iya dokter, sebentar dokter.
Ya.
Untuk jaringan lagi satunya saya lupa dokter, tapi saya bisa menambahkan tadi jaringan-jaringan yang terdapat di cap stage dan di bell stage-nya dokter.
Ya, silakan. Bagaimana pendapat Dentino?
Kalau untuk di cap stage-nya itu terbagi menjadi 3, yaitu di yang pertama ada stellate reticulum, yang kedua ada outer enamel epithelium, yang terakhir ada inner enamel epithelium. Sedangkan yang untuk bell stage-nya itu terbagi menjadi 3 juga, yaitu ada outer enamel epithelium, yang kedua inner enamel epithelium, dan yang terakhir ada epithelium.
Oke, jadi lebih banyak ya. Jadi ininya ya, apa namanya, rangkumannya ya. Mungkin tadi kita belum notes juga bahwa setelah tahapan-tahapan tersebut ya, ada pembentukan juga akarnya ya, atau akar gigi ya, atau root formation-nya itu. Gitu ya. Baru setelah itu dilanjutkan dengan tahap erupsi. Tadi juga ada notes-nya juga bahwa pada gigi yang ada desiduanya itu dental lamina ya dimulai. Tapi kalau misalnya gigi molar, nanti dia langsung jadi gigi permanen seperti itu ya. Jadi bisa tampak juga tadi ya. Itu dari asalnya tuh dari bayi sudah ada, dan ada juga tadi apa ya istilahnya pada saat akhir dari bell stage itu kan dia menghilang ya tangkainya itu. Nah itu ada bisa menjadi gigi yang lain juga gitu. Jadi kadang-kadang ada orang yang misalnya giginya atau banyak, kan pernah ada ya yang viral di internet tuh orang banyak giginya gitu, numpuk-numpuk. Nah itu bisa juga alasannya karena seperti itu ya. Atau ternyata dia terus sakit, itu pernah ada juga kalau nggak salah kasusnya, sakit-sakit begitu di ronsen ternyata di atasnya itu banyak apa bakal giginya itu, cikal bakal giginya. Mungkin itu alasannya kalau adik melihat dari odontogenesisnya ya, bisa adik jelaskan mengapa hal tersebut dapat terjadi. Oke, mungkin kita lanjut ya Dek ya. Pas sudah terdengar Dek?
Here the cells of the inner enamel epithelium differentiate into secretory ameloblasts. Ameloblasts are the cells that build enamel through the secretory process. These cells have a cytoplasmic extension on their distal ends called a Tomes process. Its sole function is to secrete enamel. This animation will focus on a small group of cells in order to examine the secretory process more precisely. Each ameloblast begins to secrete hydroxyapatite crystals from its Tomes process to create a layer of enamel. Crystals secreted from the proximal portion of the Tomes process are oriented perpendicularly to those secreted from the distal portion. This secretion pattern creates the rod-interrod formation of the enamel. The ameloblasts continue to secrete the hydroxyapatite crystals layer by layer. Because enamel is deposited incrementally, lines called the stria of Retzius are visible in the enamel. After the ameloblasts complete the deposition of enamel, they enter a maturation stage. The cells then secrete more minerals onto the enamel while absorbing most of its proteins. This process hardens the enamel further. The construction of enamel is now complete. This layer of enamel is the only one that will be created, and if properly cared for, will carry on through adulthood.
Bagaimana? Ada yang mau ditanyakan oleh adik-adik atau didiskusikan? Bagaimana, Dek? Nah, tadi amelioblast, masih ingat nggak kira-kira dia akan membentuk bagian struktur gigi apa? Komang Ayu. Oh ya, silakan. Siapa ini yang mau menjawab?
Dava, Dokter absen 28.
Ya, Dava, silakan.
Jadi amelioblast itu membentuk enamel, Dokter.
Oke. Nah, tadi kan dijelaskan juga ya, dia berbentuk enamel itu berlapis-lapis, terus menjadi terjadi mineralisasi, ya kan? Nah, kira-kira untuk proses mineralisasinya itu dominannya terdiri dari kristal apa ya dia? Hidroksi?
Izin jawab, Dokter.
Ya, silakan.
Kristal hidroksiapatit, Dokter.
Iya, hidroksiapatitnya berapa persen kira-kira dari kuliahnya?
Izin menjawab, Dokter. 98%.
Ya, 98% ya. Jadi kuat banget kan itu ya. Tadi dibilang salah satu komponen terkuat ya di tubuh kita. Gitu. Dia 98% hidroksiapatite. Nah, kalau dibedakan dengan dentin dan sementum, karena dia 98%, dia tidak terdiri dari apa biasanya? Kalau yang, ya, silakan Dek.
Tidak memiliki kolagen.
Ya, jadi sangat, kalaupun ada pun sangat sedikit, karena dia udah 98%-nya dominan hidroksiapatite. Kalau yang lain, dia masih ada kolagennya. Jadi, walaupun dia keras, kolagennya ya tipe 1 itu juga bisa menyebabkan jaringan itu lebih keras, tapi dia di sini hidroksiapatite-nya lebih banyak ya. Nah, kalau yang 50% apa ya? Struktur apa?
Izin jawab, Dokter.
Ya, silakan. Sementum. Nah, kalau sementum tuh sama kuat dengan, kurang lebih sama kuat seperti tulang, ya, seperti itu, ya. Baru di antaranya itu ada si dentin, ya. Jadi si dentin itu lebih keras sedikit dari tulang, tapi dia tidak sekeras si enamel atau email itu, ya. Nah, tadi dilihat yang khas pada si enamel itu di si amelioblastnya itu tersusun secara apa? Ada di gambarnya itu juga di videonya tadi. Pris? prisma ya, membentuk enamel rod gitu ya. Oke, kita lanjut yang
At the end of the crown stage, the enamel is completely formed. It is covered by the reduced enamel epithelium that protects the enamel of the dental follicle. All this lodged within the bone crypt. The root's formation starts with the proliferation of the epithelial cells of the cervical loop, located in the region of the cervical margin of the crown. This creates an epithelial sheath, which bends inwards to form Hertwig's epithelial root sheath. Hertwig's epithelial root sheath is a bilayered cellular structure composed of an inner epithelial layer facing the dental papilla and an outer epithelial layer facing the dental follicle. The apical bent portion of the sheath is named epithelial diaphragm. Its role is to induce the radicular dentinogenesis. For this to happen, the diaphragm sends induction messages to the ectomesenchymal cells of the apical papilla. These messages induce the differentiation of the ectomesenchymal cells into odontoblasts. The newly formed root odontoblasts then secrete the radicular mantle dentin in contact with the inner cells of Hertwig's epithelial root sheath. Along the dentin matrix thus formed, the cells of the outer epithelial layer disintegrate, leaving only the inner epithelial layer. The cells of this sheath then synthesize and secrete enamel-related proteins before detaching from the root surface. The mantle dentin and enamel-related proteins come thus directly in contact with the dental follicle, inducing the primary cementogenesis. For this purpose, cells of the dental follicle react to these induction signals and differentiate either into fibroblastic cells that migrate towards the root surface with a perpendicular orientation, or into cementoblasts placed parallel to the surface of the tooth. Then, the fibroblastic cells secrete the extrinsic fibers, and the cementoblasts secrete the intrinsic fibers of the primary cementum. And that is how the dentin and the primary cementum of the root are formed.
In total, an adult has 32 teeth, and they do everything from chew on gum to rip apart a delicious burger. Each tooth contains both enamel and dentin. So the physical properties of enamel and dentin are complementary. There's the extremely hard and unyielding enamel on the outside of the dentin foundation, below which is somewhat flexible and absorbs stresses from chewing. By volume, the majority of a tooth is made of dentin, which is a hard, whitish-yellow mineralized tissue. In fact, a good example of how dentin looks is ivory in elephant tusks, which are solid dentin all the way through. So if we cut a human tooth in half, we see a number of layers. From the outside to the inside, the tooth crown is covered with translucent-ish enamel. Next, there's the dentino-enamel junction, which is where enamel and dentin meet. Right under that is a thin layer of mantle dentin. Next follows a layer of primary dentin. As we move towards the middle, primary dentin becomes somewhat softer, and this is called secondary dentin. Mantle dentin and primary dentin are made before we're born, whereas secondary dentin grows continuously to support the primary dentin. The secondary dentin grows from the soft, unmineralized dentin, called predentin, which is just above the pulp. Additionally, in some places, there's tertiary dentin, which is a sort of band-aid that helps fix up injured teeth. It's also important to note that the tooth is covered by enamel only on its crown. The root is covered by a slightly softer substance called cementum. The process of creating dentin is called dentinogenesis. For primary teeth, it mostly happens around the 14th week of fetal development. And for permanent teeth, it mostly happens when an infant is about 3 months old. After that, the process continues to happen, but at a very slow pace. Dentinogenesis is performed by odontoblasts, and it's done from the outside inwards. So the process starts with creation of the mantle dentin, which is the outermost layer of dentin, right under the enamel. First, odontoblasts secrete a soft organic matrix made out of proteins, which is called predentin. Fibroblasts assist by creating a mesh of thick collagen fibers, called Korf's fibers, which become the framework for dentinogenesis. Think of these as rebar, which help form a very strong wall. Slowly, the odontoblasts and fibroblasts move toward the center of the tooth. Odontoblasts do this by growing a protrusion from themselves, which stays in place, embedded within the matrix, while the rest of the cell moves toward the center of the tooth, toward the pulp. These hair-like protrusions are called odontogenic processes, and they secrete calcium hydroxyapatite, which forms crystals and mineralizes the predentin. This mineralization is like concrete that settles around the rebar to make the mantle dentin layer very strong but also flexible. The end result is mantle dentin, which has numerous tiny canals, which are the dentin tubules, each containing an odontoblastic process. The next layer of dentin is called the primary dentin, and it's the thickest layer. Once odontoblasts have finished making the mantle dentin layer, they get bigger and continue building the primary dentin. Meanwhile, the fibroblasts head towards the pulp to catch a rest. So compared to mantle dentin, the primary dentin contains less collagen and more mineral content. Odontoblasts continue moving towards the center, so the primary dentin forms from the outside in. Next up is the thin layer of secondary dentin. Secondary dentin resembles the primary dentin in structure, but the main difference is that it's formed after root formation is complete, and happens at a slow rate, throughout our lifetime. Its purpose is to maintain the tooth strength for as long as possible. After the secondary dentin, there's a thin layer called the predentin, which borders the pulp. The predentin is a layer of organic matrix that hasn't yet mineralized. And as it mineralizes, it becomes secondary dentin. Unlike enamel, dentin keeps growing, regenerating, and repairing itself throughout our lifetime. So when a tooth is injured, odontoblasts residing in the pulp move out and head to the site of injury. Once they get there, they start rapidly producing what's called tertiary dentin and mineralizing it immediately. Tertiary dentin is used for damage control, in order to strengthen the damaged area. Think of the injury as a crack in a dam. It needs an injection of concrete immediately. That's why tertiary dentin is found at sites like dental caries or dental attrition, caused by excessive wear of the teeth. Alright, as a quick recap. Dentin is a mineralized structure that makes the bulk of our teeth. It's made through a process of dentinogenesis, by odontoblasts. Odontoblasts secrete the matrix, which they mineralize by depositing calcium hydroxyapatite. The outermost layer is the mantle dentin layer, which is rich in minerals and collagen. And it's followed by primary and secondary dentin layers. The innermost layer is soft, unmineralized predentin. And finally, tertiary dentin can form as a response to injury.
Oke, sejauh ini bagaimana, Dede? Sudah mengertikah untuk pembentukannya ya? Sudah terbayang? Mulai dari awal, ya, dari dentalamina, kemudian terus berubah dia berkembang. Ini sudah di bagian ini sudah sampai ke enamelnya udah, dentinnya juga ya, sama dental pulpnya juga. Tuh. Kalau yang sementum kayaknya saya nggak dapat videonya. Kira-kira dari situ sudah kebayang? Sudah. Kalau sudah, sekarang kita lihat video yang erupsi dari giginya ya.
Eruption of teeth is the process by which developing teeth move through the jaw bones and overlying mucosa to emerge in their respective place within the oral cavity eventually. Now, humans are diphyodonts, which means we have two sets of teeth during our lifetime. The first set, the primary teeth, also called deciduous teeth or baby teeth, start erupting at around 6 months of age. And, by about 6 years of age, the primary teeth fall out and are replaced by a set of permanent teeth that stays with you for the rest of your life. Tooth eruption occurs in 3 phases: the pre-eruptive, eruptive, and post-eruptive phase. The driving force behind the eruption of teeth is still unknown, but is thought to be due to a combination of a few factors, which include signals originating from the dental follicle, root formation and elongation, which could drive the tooth in order to acquire space within the jaw, and formation of PDL, which provides an occlusal force aiding in eruption. Okay, let's look at all the stages one by one, starting with the pre-eruptive phase. In this phase, the tooth germs are growing within the jaw bones. As the bones grow in length, width, and height, more space becomes available for the tooth germs to spread out and grow without affecting each other. Lengthening of the jaw bones allows the anterior tooth germs to move mesially, or forward, and the molar tooth germs to move distally, or backward. At the same time as the bone widens, the tooth germs move buccally, or outward, and as the height increases, the tooth germs move closer to the surface. That is, the mandibular tooth germs move upwards, and the maxillary tooth germs move downwards. In this phase, movement of the tooth germ is achieved by 2 methods: bodily movements and eccentric growth. In bodily movement, there is a remodeling of the bony crypts through resorption of bony crypt wall in the direction that the tooth is moving. This is followed by depositing new bone on the opposite crypt wall, hence creating a path for the tooth germ. Eccentric growth is where a part of the tooth grows relatively faster than the rest of the tooth. Eccentric growth helps the crown of the tooth reorient itself as the jawbone keeps growing. Now, the position of permanent tooth germs is also changing in relation to the primary tooth germs. At the beginning of the pre-eruptive phase, the successional tooth germs lie lingual to their primary predecessors, with their occlusal surfaces on the same plane. And, by the end of the pre-eruptive phase, the permanent anterior teeth ends up lingual and apical to the primary anterior teeth. And the permanent premolars come to rest underneath the divergent roots of the primary molars. However, this change in position is more due to the movement of the primary tooth and growth of the jaws rather than the movement of the permanent tooth itself. Now, you'd think that without a primary predecessor, the permanent molars would be developing unhindered. But their location right near the ends of the jaw is a very cramped up space. And so, the permanent molar tooth germs in the maxilla grow with their crowns tilted distally, and those in the mandible have their crowns tilted mesially. Only when the jaw grows to a sufficient size can the permanent molars move into a more vertical position. Next, the tooth germs enter the eruptive phase, or the pre-functional eruptive phase, which begins simultaneously with root formation. The tooth ascends through the bony crypt and the connective tissue and finally comes into contact with the oral epithelium. The reduced enamel epithelium over the tooth crown then proliferates along with the overlying oral epithelium to form a single membrane. and this epithelium is pierced by the tooth to finally enter the oral cavity. The fused epithelium lining the sides of the tooth is now called the functional or attachment epithelium. Through the rest of the eruptive phase, the tooth gradually rises into the oral cavity till it reaches the plane of functional occlusion. Now, several changes are happening in tissues surrounding the teeth that help in the eruptive phase. In the region above each tooth, a path called the eruptive pathway is cleared through the bone and connective tissue. The reduced enamel epithelium covering the dental follicle secretes colony-stimulating factor 1, or CSF1, and transforming growth factor beta 1, or TGF beta 1, into the surrounding tissue. The CSF1 and TGF beta 1 attract tons of monocytes that then differentiate into osteoclasts. These osteoclasts eat away or resorb the part of the bony crypt overlying the tooth. Without the bony crypt, the dental follicular cells become continuous with the cells of the lamina propria of the overlying oral mucosa. The reduced enamel epithelium then goes on to secrete some enzymes that break down overlying the connective tissue, nerves, and blood vessels, forming an eruption pathway for the tooth. The lack of blood vessels and nerves helps in a relatively bloodless and painless eruption. Now, as the tooth erupts, the epithelial root sheath begins to proliferate and starts to form the root. At the same time, bundles of collagen fibers start appearing in the surrounding dental follicle. The collagen bundles get invaded by fibroblasts that lay down fibrous tissue and thickens the bundles to form the periodontal ligament, or PDL. The first PDL fibers appear at the cervical area of the tooth root and radiate coronally to the alveolar process. As the tooth erupts, more PDL fibers appear along the length of the root and existing ones become more prominent. In addition to fibroblasts, PDL fibers contain a special type of fibroblast called the myofibroblast. Myofibroblasts are cells with contractile properties and are thought to speed along the eruption. Moreover, researchers have found that PDL fibers continuously attach and detach from the tooth as it erupts. It is thought that these dynamically changing PDL fibers play a role in stabilizing the tooth and help in the eruption process. Some changes also happen to the tissue below the teeth. Eruption of the tooth leaves behind some space at the bottom of the bony crypt. This space gets filled up by fine, bony trabeculae, or bone with tiny gaps in its structure. The bony trabecule, also sometimes known as the bony ladder, provides support to the apical tissues. At the end of the eruptive phase, this bony ladder is resorbed to give way for the developing root tip. Ultimately, bundles of PDL fibers are laid down at the apex, extending from the root tip to the bony floor. Once the tooth reaches a plane of functional occlusion, the post-eruptive phase begins. It is a phase for checking to see if the teeth remain in the optimal position and correcting any abnormalities due to jaw growth and occlusal or interproximal wear. As the jaw height keeps increasing, new bone is deposited along the socket floor to maintain the height of the erupted tooth in the arch. Occlusal wear is compensated by cemental deposition around the apex. Whereas interproximal wear, which is the wearing of the contact surface between the teeth, is compensated by a process called mesial or a proximal shift. The mesial shift is brought upon by a combination of forces acting on the teeth. These include the anteriorly directed force generated by the teeth when they're in occlusion, the pressure exerted by transeptal fibers of the PDL to keep neighboring teeth in contact, and finally, the pressures exerted by the surrounding soft tissue like the tongue and cheeks. The post-eruptive phase continues as long as the tooth remains in the oral cavity. Although most teeth have a similar mechanism of eruption, they vary in their eruption and exfoliation times. The eruption of primary teeth is commonly known as teething, and it usually begins at around 6 months of age and goes on until about 24 months of age. The first to come are the mandibular lower central incisors, which erupt at around 6 to 10 months of age. Next come the maxillary upper central incisors at around 8 to 12 months, and then the upper lateral incisors at around 9 to 13 months. The lower lateral incisors erupt at around 10 to 16 months, the upper first molar at 13 to 19 months, lower first molar at 14 to 18 months, upper canine at 16 to 22 months, lower canines at 17 to 23, lower second molar at 23 to 31 months, and finally the upper second molar at 25 to 33 months. Now, both the central incisors are exfoliated by 6 to 7 years, both lateral incisors by 7 to 8 years, both first molars fall by 9 to 11 years, both canines and second molars fall off by 10 to 12 years. Now, the first permanent teeth to come in are the permanent molars, which usually appear around 6 to 7 years of age. The permanent first molars erupt distal to the primary second molars, thus no primary tooth exfoliates to make room for them. The next to erupt are the lower central incisors at around 6 to 7 years. The eruption of these and all subsequent permanent teeth, except permanent molars, is preceded by the exfoliation of an overlying primary tooth. Then come the upper central incisors and upper and lower lateral incisors at around 7 to 8 years. The lower canines erupt at around 9 to 10 years, the first and second premolars at around 10 to 12 years, and the upper canines at around 11 to 12 years. The second permanent molars erupt around 12 to 13 years. Finally, the third permanent molars, or wisdom teeth, usually don't erupt until around the ages of 17 to 25, and sometimes never erupt, so they remain impacted in the jaw or simply aren't present at all. Alright, as a quick recap, eruption of teeth is the process by which developing teeth move through the jawbones and overlying mucosa to emerge in their respective place within the oral cavity eventually. The first set, the primary teeth, also called the deciduous teeth, start erupting at around 6 months of age. And, by about 6 years of age, the primary teeth start to get replaced by a set of permanent ones that pretty much stick around for the rest of your life with proper care. The eruption process itself can be divided into 3 phases: pre-eruptive, eruptive, and post-eruptive phases. The pre-eruptive phase is a preparatory phase that occurs before root formation and positions the tooth germ for eruption within the jawbone, kind of like how an airplane is wheeled onto the runway before takeoff. The eruptive phase, also called the pre-functional eruptive phase, begins at the time of root formation and consists of movements that raise the tooth upwards, from within the bones to a functional occlusal position within the oral cavity. The post-eruptive, also called the functional eruptive phase, begins once the teeth are in occlusion and consists of movements that maintain the position of erupted teeth as the jaw grows and compensates for any wearing of teeth.
Ya, jadi begitu ya Dek ya untuk proses erupsi dari giginya. Ya, jadi adik-adik sekarang sudah tahu ada notes tuh waktu di recap umur berapa aja ya. Kalau misalnya anaknya udah umur segini, pernah ada pertanyaan, anak umur 1,5 tahun, belum muncul giginya. Kira-kira apa yang akan adik pikirkan, adik berikan edukasi kepada ibunya atau orang tuanya? Apa pemikiran adik-adik kalau berdasarkan adik melihat proses erupsinya tadi? Pasien nih datang, Dok, anak saya giginya kok belum tumbuh ya umur 1,5 tahun. Silakan pendapatnya, jadi nggak ada benar nggak ada salah ya, langsung aja. Boleh kok. Natania. Jika adik sebagai dokter giginya, apa yang akan adik utarakan dan apa yang akan adik lakukan kira-kira? Silakan. Mulan atau siapa? Boleh, silakan.
Yang off cam itu, Dok.
Ya boleh ditunjuk, boleh Pak Veno. Yang mana tadi kata Pak Veno? Silakan Pak.
Gusti Agung Dwi Mayuni Putri.
Iya dokter. Hadir dokter. Kalau menurut saya, kenapa anak itu belum erupsi pada umur 1 tahun karena masih wajar.
Kecil suaranya, Dek.
Tes, apakah suara terdengar? Halo?
Iya, masih kecil sekali.
Dibesarkan ya.
Halo?
Ya, terdengar, Dek. Tapi memang sangat kecil suaranya.
Tadi pertanyaannya, gigi anak belum erupsi umur 1 tahun ya dokter?
Ya, kira-kira 1,5 tahun lah. 1 tahun kan kecil ya. Ya boleh lah 1 tahun gitu. Apa yang akan adik umumkan? Saya 1 tahun lah, anggaplah. Boleh. Apa yang akan adik, berdasarkan pengetahuan yang adik dapat nih, adik punya nih, apa yang akan adik bicarakan atau utarakan kepada orang tuanya?
Mungkin saya akan memberitahu kepada ibu dari pasien tersebut bahwa rata-rata gigi erupsi pada anak itu pada umur 6 bulan dokter, dan masih wajar kalau misalkan umur 1 tahun itu belum erupsi dokter.
Oke. Terus bagaimana dok gitu kalau nggak tumbuh-tumbuh? Christopher? Bagaimana Christopher?
Izin menjawab dok, mungkin bisa diberitahu kalau di erupsi itu bisa antara 6 sampai 24 bulan. Mungkin belum cukup waktunya untuk anak tersebut untuk giginya tumbuh.
Lalu orang tuanya akan bertanya, masih bisa ya dok ya? Berarti apa yang harus saya lakukan supaya anak saya itu giginya cepat tumbuh? Dari video tadi kan ada ya, kira-kira apa yang mempengaruhi dia pertumbuhan atau erupsi dari gigi itu kira-kira?
Mungkin bisa memberi makanan yang lebih padat dok.
Ya, jadi lebih padat dia ya, tergantung dengan umurnya atau merangsang dengan titer gitu ya, tuh untuk merangsang terjadinya erupsi dari gigi. Nah, kalau misalnya orang tuanya oh gitu ya dok ya, berarti nanti kalau misalnya sudah umur berapa misalnya kira-kira misalnya udah umur 3 tahun gitu kan, harusnya kan sudah mulai banyak ya dok ya. Apa yang harus saya lakukan kalau misalnya belum tumbuh juga? Atau harus bagaimana? Saya datang lagi, dia datang misalnya umur 3 tahun misalnya, gimana? Ya, karena terbatasnya waktu, mungkin adik bisa lakukan, sarankan kalau misalnya pada anak-anak yang sudah lebih besar, tapi dia belum juga, kita lihat bakal giginya itu ada apa enggak. Nah, itu bisa kelihatan dengan dari ronsen. Jadi bisa dilakukan ronsen gigi ya. Dilihat ada enggak dia di dalamnya itu bakal giginya. Nah, kalau ada, apa hal-hal yang bisa mempengaruhi untuk dia bisa erupsi. mungkin dikonsultasikan ke bedah mulut atau bagaimana gitu ya. Jadi mungkin itu kurang lebih seperti itu dari proses-proses erupsinya itu ya. Jadi adik-adik bisa tahu. Dan ini juga tadi ada dari proses erupsinya itu ada molar ketiga ya, itu menarik ya. Itu sering terjadi impaksi dari molar 3. Kalau dilihat dari prosesnya tadi ada ya. Jadi kenapa dia? Karena pada saat waktu kecil itu dia kan kecil ya, belum dapat tempat. Tapi dari penjelasan video tadi dia akan makin pertumbuhan rahang akan makin makin berkembang lagi, sehingga dia nantinya yang tadinya di belakang itu di atas, lebih ke atas, di belakang akan turun gitu. Tapi ada kalanya dia tidak turun juga gitu. Atau bahkan kalau turun posisinya lain menekan gigi yang lain, itu yang bisa menimbulkan sakit pada molar 3-nya ya. Kadang-kadang perlu dikeluarin gitu ya, dilakukan pembedahan mulut untuk membantu mengambil molar 3-nya jika terganggu seperti itu. Oke, jadi dari kami, mungkin dari Dokter Dia dan dari Pak Fiano ada tambahan? Jadi kalau dari kita video tadi ya, video session yang kita dapatkan tadi, jadi ada kita recap ya, atau kita simpulkan bahwa dari proses pembentukan gigi hingga erupsi gigi tadi ya. Jadi dari pembentukan gigi, gimana gigi itu terbentuk ya, sel apa, struktur-struktur apa yang terbentuk di dalamnya terkait dengan itu, kemudian bagaimana dia erupsi gigi itu bisa sampai erupsi sehingga bisa ada gigi yang seperti kita ada lah istilahnya gitu ya, sampai gigi permanen ya. Kita juga tahu bahwa ada peran fluoride di situ juga ya, kalau kita gosok gigi ya, kalau si enamel walaupun dia keras, tapi dia juga kalau misalnya terus terpapar oleh asam, dia bisa berbahaya juga ya, bisa menimbulkan karies gigi misalnya, atau bukan karies, maaf, akan menimbulkan gigi yang bolong seperti itu ya. Kalau enamel kan agak sulit ya, kalau dentin tadi kan kita lihat ya masih ada pertumbuhannya itu, jadi tersiari dentin seperti itu. Tapi kalau enamel agak sulit gitu, walaupun dia masih ada pertumbuhannya juga, tapi tidak seagresif atau giat si dentinnya itu gitu ya. Kalau bolong ya agak sulit gitu, makanya ya. Mungkin itu saja untuk video session kali ini ya. Ada tambahan lagi mungkin Pak Fiano dan Dokter Dia?
Dari saya cukup dok, paling nggak adik-adik tadi kan sudah melihat ya, ada stage-nya tadi itu ya, dari awal jaringan ada 2 jaringan. Yang pertama itu kan ada epitel primitif ya dengan jaringan mesenkimal, yang keduanya yang sama-sama mengatur tuh ya, mengatur dari pertama pembentukan dental lamina kalau tidak salah tadi ya, kemudian ada stage-stage-nya tadi sudah di recap yang video paling pertama tadi ya. Pertama dan kedua tadi yang paling saya kira tadi yang paling bagus penjelasannya tadi. Terutama ada 3 stage tadi ya, paling tidak itu di ujian pasti ditanyakan pasti ya. Jadi ada pembentukan bud gitu ya, atau kuncup ya kalau dalam bahasa Indonesia begitu. Kemudian ada cap gitu ya, ada pembentukan cap itu kan seperti apa ya? Seperti tudung gitu ya, atau topi gitu kan cap itu gitu ya. Jadi tadi adik-adik bisa lihat tadi ada bagian karena ada laju proliferasi yang berbeda tadi ya. Yang bagian tengah tuh lebih lambat daripada bagian perifer tadi ya, kita lihat tadi. Sehingga kenapa kemudian terbentuk ada seperti struktur cap tadi itu. Kemudian yang terakhir ada bell stage tadi. Jadi adik-adik bisa lihat tadi bentuknya seperti bell gitu ya, seperti lonceng gitu ya. Sehingga nanti terbentuk ada bagian servikalnya tadi ya, yang menjadi cikal bakal sebelum kemudian menjadi menjadi rootnya atau akar dari gigi gitu ya. Saya kira mungkin adik-adik mungkin di luar dari video ini, mungkin di kuliah lain barangkali sudah pernah dijelaskan gitu ya. Kemudian tadi dentinogenesis juga itu ya penting ya, tadi ada beberapa lapisan, tadi ada primer, sekunder, tersier gitu ya, dentin gitu ya. Pertanyaan saya, apa yang terjadi ketika terjadi tooth injury? injury pada gigi. Apa yang tadi adik perhatikan tadi? Ini salah satu proses pentingnya. Ada yang menyimak tidak tadi?
Izin menjawab dokter, terjadinya tertiary dentin.
Sebelum itu apa? Tertiary dentin kan nanti dia membantu untuk mineralize kan. Sebelum itu apa? Ada sel apa di sana? Apa tadi? Kalau kita lihat tadi kan yang bagian enamel begitu sudah pertumbuhan sudah selesai kan dia ya sudah tidak berkembang lagi gitu ya. Kecuali yang di bagian dentin itu kan terus dia growing begitu ya. Terutama ketika terjadi injury gitu ya. Ada sel apa tadi?
Odontoblas.
Odontoblas ya, itu pentingnya. Jadi odontoblas yang di pulpa itu kemudian dia bergerak atau moving ke bagian injurinya itu ya. Ke sana baru kemudian terjadi tadi dijawabkan tadi siapa tadi yang menjawab? Dentino tadi yang menjawab.
Ya, dokter.
Ya, ini namanya pas sekali ya Dentino ya namanya. Oke, jadi baru kemudian tertiary dentin tadi yang membantu gitu ya proses mineralisasi itu ya. Itu saya kira itu yang bisa saya tambahkan begitu ya adik-adik ya. Jadi saya kira semua video nanti kan di-share ya oleh Dr. Asri ya. Kan semua video tadi ada linknya masing-masing gitu. Atau Anda juga bisa melihat langsung di YouTube gitu ya. Jadi video session ini hanya sekedar supaya kita sama-sama melihat gitu ya prosesnya seperti apa. Karena kalau sudah bicara proses ya, kalau kita hanya bicara saja kurang gitu ya. Tapi kalau dengan video, saya kira tadi adik-adik bisa melihat gitu ya prosesnya seperti apa. Gitu. Oke, itu dari saya. Dr. Asri masih di sini atau?
Ya, masih Pak Fiano. Oke, ya jadi itu saja sih tambahan dari saya tadi recapnya. Ya, mudah-mudahan dengan adanya video session ini adik-adik lebih bisa dapat gambaran lebih ya terhadap bagaimana struktur gigi, kemudian bagaimana pembentukan gigi, dan bagaimana gigi itu erupsi. Sehingga nanti kalau adik-adik dapat kasus-kasus seperti tadi yang kita diskusikan ya, itu kasus, maksudnya bukan kasus, itu pertanyaan yang pernah terjadi gitu, ditanyakan oleh pasien gitu. Bagaimana, apa yang harus kita lakukan. Nah, ternyata kalau kita paham mengenai proses, mengenai strukturnya, komposisinya, kemudian proses pembentukannya sampai erupsinya itu, kita bisa istilahnya menjelaskan kepada pasien apa yang harus kita, ini sudah masih bisa kita tunggu Pak, enggak. Kemudian nanti kita bisa istilahnya apa yang harus kita lakukan selanjutnya, terus bagaimana jika itu tidak terjadi seperti itu. Jadi ada dasarnya atau basicnya gitu, karena kalau orang lain ya bisa aja misalnya menjelaskan, misalnya kayak maaf ya mungkin tukang gigi gitu kan, tapi kan adek kalau dari sisi keilmuannya harus ada gitu. Jadi dengan basic keilmuan ini mudah-mudahan bisa nanti kalau adik-adik dapat pasien bisa inget-inget lah istilahnya sedikit-sedikit walaupun sudah lupa, tapi kalau paham mudah-mudahan masih ingat lah, oh ini karena ini seperti ini jadinya itu seperti itu gitu. Mungkin kurang lebih seperti itu dari saya. Jika tidak ada mungkin kita bisa tutup. Ya, silakan, Dek.
Izin bertanya, dokter.
Silakan, Wira.
Izin bertanya mengenai praktikumnya nih, ke tanggal berapa ya, dokter?
Oh, mungkin dokter Dia mungkin bisa, saya kurang hafal juga ya. Kayaknya saya ini salah nulis kayaknya waktu itu juga soalnya.
Iya.
Ya, yang
Dokter
praktikum.
Asri, oh ya. Untuk praktikum mungkin bisa digabung ya Pak ya, Pak Fiano.
Ya, digabung. Tadi saya udah chat ke siapa tadi, Anta tadi kayaknya.
Iya. Soalnya terkait dengan laboratorium di FKIK itu dipakai untuk praktikum juga, jadi biar nggak kalian mundur-mundur, nanti kena libur, jadi nanti kita gabung seperti ini kurang lebih ya. Untuk waktunya nanti kami chat lagi ya.
Ya, baik dokter, terima kasih.
Iya, kita online deh. Soalnya biar kalian nggak mundur terus, kasihan nanti.
Oke, mungkin nanti ada informasi lagi ya, Dek ya, tambahan lagi atau mungkin bisa dijapri ke dokter Dia ya, terkait dengan praktikum. Mungkin itu saja kita tutup ya, Pak Fiano, dokter Dia, bagaimana? Adik-adik?
Ya, dokter.
Ya, bisa dokter.
Dari siang mereka.
Kasihan, mohon maaf ya, Dek ya, karena ada benturan jadwal, akhirnya Adik dapat sore ya. Mudah-mudahan masih bisa ngerti ya, Dek ya. Oke, terima kasih atas partisipasi adik-adik. Saya salut sama adik-adik, tetap ya Dek ya, 100 orang ini masih hadir dan walaupun off cam ketika ditanya juga masih nyambung lah istilahnya gitu ya. Saya apresiasi juga. Kita tutup dengan Parma Santi, Om Santi Om, salam sejahtera buat kita semua. Selamat malam. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih semuanya.
Terima kasih dokter.
Terima kasih dokter.
Terima kasih dokter.
Terima kasih dokter. Terima kasih.